This video is intended to show you the movements that are difficult to describe in the back mechanic book. Movement and exercise can decrease or increase pain. Use the guidelines in the back mechanic book to guide your decisions on which to do and which to avoid.
Why are you suffering with back pain? Why have your previous attempts failed to give you relief? It's most likely that you've not been shown the specific cause of your pain. And without knowing the cause, you have no guidance on what to stop doing and what to do. I will show you how to find your specific pain triggers, together with specific advice on how to build a pain-free foundation. Some of you who have read my book, Back Mechanic, have contacted me saying you would be much more confident seeing the actual movements in a video. We bring these to you now. These are not intended to replace the book, but to augment it and bring the assessment and movement techniques to life. Why is this a different approach, and why are you going to find a different result? The approaches here are not a repackaging of ideas from others. Rather, myself and our team at the university developed them after our 30 years of scientific investigation in the lab, where we defined injury and pain mechanisms, and in the clinic, our approaches for prevention, rehabilitation, and finally restoring performance. We discovered how the pain mechanisms work, and then we attested their effectiveness on different groups. Here's what we're sure of. Number one, you must be assured that your pain has a cause. Number two, your pain is not in your head. That wording usually comes from a doctor that does not have the skill or expertise to figure out your cause. Number three, there are many possible causes of back pain. You have a specific cause, and therefore you need a specific approach. Number four, every person is different. What may help one may hurt another. Number five, your pain history matters, as does your personal anatomy, for example. Your hips, your spine are different, and not everyone is suited to all tasks. No doubt that you've tried approaches to rid yourself of pain before. Perhaps you tried physical therapy, but it made you worse. Did they assess your specific pain triggers and show you how to eliminate them? Or did they simply give you an exercise on top of already having a painful back? Chapter 1 of Back Mechanic will show you, first, that simply because your parents had pain, it doesn't mean a life sentence of pain for you. You may have been told you've had a herniated disc or have degenerative disc disease and that your athletic career is over. Well, I've coached many athletes who have returned to successfully play in pro sports, the UFC, the NHL, the NBA, the NFL, as well as many Olympic sports. They have learned how to successfully manage this. The changes to the disc may not fully heal once the pain is gone, but certainly they learn to manage it. And be assured you will become resilient in a few years, but for now you need to learn how to manage it very successfully. The popularity of MRI images have been both a blessing and a curse. Most of you would be better off ignoring the report and the results. For example, both of these patients have been told they had degenerative disc disease. It doesn't help them one little bit in organizing their recovery. Interestingly enough, this person has an open fissure in the front of their disc, not degenerative disc disease, that's from a bending injury. This person has a compressive fracture from too much compression. Again, it's not a disease. These were specific injuries. Had they had the assessment shown in Back Mechanic, they would have had a much better, very specific direction of what to do to get rid of their specific symptoms. Another roadblock is laying in bed, which can lead to further disability. I will show you how to build a program of activity patterns into short, tolerable intervals that guarantee your success and will help you to build your resilience to enjoy life rather than making you more sensitized. If you're reading this book, you probably have not been successful with the advice from a doctor such as go do yoga or Pilates. For many, stretching a spine joint or stretching the hamstrings will not reduce pain. You need to be clear on what specific movement will help you become less sensitive to pain. A general Pilates program is not specific enough to cure your specific pain. Another roadblock is perhaps you've been taught that simply strengthening your back muscles or your core muscles will take your pain away. But how do you do that without triggering more pain? We've assessed various approaches and will show you a way that is successful in 95% of people. We know that because we measure our success rate with every person that we see. In summary, the pain is not in your head. There is a cause and you need to assess it. Number 2, if your doctor tells you to do exercise or gives you a pain pill and that's all, you need another approach. Number 3, if your clinician books you for several visits and you get a treatment of, say, chest manipulation or chest ultrasound or laser or chest massage or traction, you need another approach that directly addresses the cause of your pain. Number 4, if you can find a pain-free position, you are guaranteed success. You just need guidance on how to expand being pain-free into other movements and performing other activities. What causes your back pain? No doubt if you knew, you would have a good idea of what to do. Chapter 2 of Back Mechanic reviews how the back works and the links between specific motions, postures, and loads that trigger your back pain. So let's review some pain triggers and some concepts of stability and mobility that will help you make better decisions. Clearly, there's some part of your back that is sensitized. Certain motions, postures, and loads trigger pain. The cause of the sensitivity can run the full continuum from irritation through to actual injury. Our scientific investigations show that there is usually some tissue damage. It might be at the micro level. But the good news is that if you understand the mechanism of pain, you can enhance repair and become resilient once again. Let's start reviewing some very specific types of injuries and pain mechanisms. The first one is a disc bulge. Interestingly enough, disc bulges often start with an overload of compression. Then, after that, continually forward bending with compression causes the bulge, which I will show you now. So I'm going to apply some compression, and you're going to see right at this imperfection the bulge start to grow as I apply compression by squeezing and bending forward. And you see that disc bulge grow, and the nerve root is right beside that growing bulge. So that will happen once that mechanism starts with prolonged sitting, slouched, bending over and picking up heavy boxes. And yet, when you stand up and go for a walk without the bending forward mechanism, there is no pain, and you can see why the bulge shrinks. So the take-home message is to bend using your hips if you want to avoid that specific pain trigger. The next injury to the spine is the end plate fracture, which is associated with too much compression to the spine. So as the spine sees the compression, it's squeezed like this. The top and bottom of the vertebra are actually cartilage, so we're looking inside the vertebra now. So you can see as the spine is exposed to compression, the gel nucleus in the middle gets squeezed and it works its way up through the fracture into the vertebral body. This results in a compression intolerance or compression causing pain within the patient, and the way to reduce that pain sensitivity is to avoid an overload of compression and be rather moderate in the amount of muscle bracing that you're performing. That sensitivity, by the way, can last a year or even a year and a half of compression intolerance. The next category of pain mechanism has to do with micro movements at the joint. So as the disc becomes damaged, the end plate becomes damaged, the disc tends to flatten a little bit. And as a tire with improper inflation level is a bit sloppy on the road, that disc becomes a bit unstable, and you can see the micro movements occurring at the joint. And these can irritate nerves, causing pain sensitivity with micro movements. The way to reduce those is to add a little bit of muscular bracing around the core with the core musculature to stiffen out those micro movements and alleviate the pain. And as the disc flattens, these are called facet joints in the back, and they're responsible for guiding motion within the spine, controlling twist and various bending movements. They too will become irritated with too much repeated motion, as you can see the friction occurring in the joints there, and they will become irritated and pain generators with too much motion. Yet once again, controlling the amount of motion and stiffening the joint will reduce that particular pain trigger. The next category of pain trigger emanates from the pelvic ring and the sacroiliac joints. You may be familiar with the controversy on the internet about performing squats and the link to back pain. Some people have said, well, squatting is hard on the back. Well, it may or may not be. It depends on whether or not the load is suited to the capability of the person. But what they have recommended, instead of doing two-legged squats, is to do a single-leg squat or a Bulgarian split squat like this. Well, as you can see, this stresses one half of my pelvis to mutate or rotate that way, and then the other side to rotate in the opposite direction. And what that will do, if it's done too often and with too heavy a load, you can see the motion that takes place, actually stressing the sacroiliac joints to the point where they become sensitized and painful. So the trick there, once again, is to reduce the amount of lunging and split squats in the individual who has that type of sensitivity, and control the amount of motion and tighten up that pelvic ring with the stabilization exercises that you're going to learn in one of the next modules. Notice that every one of these injury and pain mechanisms can be addressed as long as you know what you're dealing with. All of these models we're using to describe the injury mechanisms were based on the documented mechanisms from our laboratory, and they're produced by dynamicdiscdesigns.com. And now let's move on to a few thoughts on pain, stability, and instability. No doubt you've heard about core stability and stabilization exercises. Well, what are the links between pain and instability? There's actually 3 levels or concepts of stability, all very easy to explain, and I'll do so with a couple of models. Let's first consider this idea of proximal stability. And what does that mean? Well, consider first of all my pec major muscle or my bench press muscle as an example. That muscle crosses one joint, my shoulder joint. So if we consider the muscle, it attaches proximal to the ball and socket joint on my rib cage, and it attaches distally on my arm. So when that muscle is activated and contracts, it causes my arm to flex around this way. But that is its distal effect. Its proximal effect is it bends my rib cage towards the joint as well. So if I was trying to create a push and I use just that muscle, you see it's not a very effective mechanism. But if I lock down the proximal side, 100% of that muscle action goes to arm flexion and a very effective push. So the summary is proximal stability and stiffness creates wonderful distal athleticism. And we see that time and time again in people walking, bending, lifting, pushing open a door. Proximal stability, locking your core, unleashes athleticism through your legs, opposite to the hip joints, and through your arms, opposite to the shoulder joints. So core stability is non-negotiable. You have to have sufficient core stability. The second important concept of stability involves the role of muscle and what you may have heard of as core stability. The muscles, when they contract, yes, they create force, but they also create a stiffness. When you activate a muscle, it creates force plus a stiffness. That's why if you want to move, you have to relax the muscle. That's the interplay. So notice the model here of a stiffened spine. It bears load because it has stiffness, and we've just artificially created that by having a tight wire running down the middle of the spine, so it can bear load. As I'm sitting here now, my muscles form this guy wire system, allowing my spine to support my load. Now, if I reduce the stiffness in the wire, watch what happens. You see the whole column buckles. So it's non-negotiable. You must have a certain amount of muscular stiffness in your core that allows you to bear load. The more load that you're required to bear and lift, the more muscular stiffness you must create to support that spine and stop it from buckling. And the third important element of core stability has once again to do with muscle stiffness. I've already reviewed that with injury, that causes a laxity at the joint and micro movements to occur. But as the person learns to create core stiffness in their muscles, they brace the spine and engineer out those painful micro movements. So in summary, core stability has to be blended with mobility at the ball and socket joints, mobility at the hips, mobility at the shoulders, and a appropriately stiffened core creates pain-free, resilient athleticism. And now for a little tutorial on pain, the point being you don't get used to pain. In fact, the more back pain you have, the better you get at sensing it. Let me show you what I mean. Let's go back to our disc injury. Recall that there was an imperfection in the back of the disc there, but if we look down into the disc at the site of the injury, the response of the body is usually to grow nerves and vessels at the site of the injury. So you actually get more equipped to sense pain after the first injury. Well, this idea that pain is in the head is a gross simplification. Clearly, the pain has to start with mechanical or chemical irritation at the site of the damage. It travels through the nerves and eventually to the brain where it's interpreted. But consider picking the scab as an analogy. If you keep irritating the tissues and picking the scab, they stay sensitized. The whole trick and involvement of this new area of science called pain science is you wind down the pain sensitivity by stop picking the scab and creating the cause. Instead, let the sensitivity wind down. Let it settle. Choose movements that don't irritate the injury, and the pain sensitivity will wind down and subside. So you're starting to see the supreme importance of good movement. Move in a way that avoids the pain trigger. Allow the pain to wind down. The next really important concept is this notion of cumulative sensitization. Consider a bank account. If every time you move well, you could put $1 into your bank account. At the time, it's such a small amount you don't know. But also consider that every time you move poorly and slightly trigger the pain, you've caused a sensitization and you've stolen $1 out of your bank account. Many of you are bankrupt. All day long, you've stolen money out of your pain account. You're highly sensitized and you have no bank account left to allow you to go and train or go for a walk or play with your children pain-free. However, had you performed good spine hygiene and kept putting dollars in your pain bank all day long, by the end of the day, you'll have enough money now to go and do a few activities pain-free. There are various medical institutions and insurance companies who say back pain should heal within, say, 6 to 12 weeks. This is an absolute misrepresentation of the science. Once the disc is damaged, whether there's been end plate damage or disc damage, you set off a cascade of change. The bones start to adapt with spurs as the micro movements continue. The additional work and grinding done by the facet joints cause them to go a little bit arthritic. This whole process can take 10 years, but eventually the good news is that all of this activity eventually causes the joint to stiffen. And the interesting thing is the pain is then gone. So you will find very few older people who complain about back pain. They will say the peak of my back pain was in my 20s, 30s, and 40s. It started to go away in my 50s, and by the time I was 60 and 70, it was gone. And that is this degenerative cascade that we're describing here. So keep the faith and be very assured that you will grow out of your pain. The trick now is for you to manage your pain very well so it goes to subclinical levels and you don't notice it anymore. In Chapter 3 of Back Mechanic, I provide you with rules and checklists that will guide your decision as to whether or not you need surgery. We'll show you how to select a surgeon. Basically, you must be assured that the surgeon's knife will cut the pain out. If the surgeon simply looks at an MRI image and declares that you need surgery, please see another surgeon. The surgeon must confirm that the target structure is truly the cause of pain. If you're like many people, you will have more than one source of pain and the chance for success greatly diminishes. Or better yet, follow our approach called virtual surgery. What is that? Surgery works sometimes because it is forced rest. When we simulate this, it is amazing how many people get better. Always try virtual surgery. Pretend you had the surgery, it forces you to rest, and then you recover as if you were a post-surgical patient. Don't roll the dice if you don't have to. There's no turning back. But with virtual surgery, you will be surprised how many of you recover. In Chapter 4 of Back Mechanic, we discuss the code to back health. You're different than everyone else. You must take control and don't expect anyone else to fix your back for you. First, we need to assess your specific pain triggers. Then we eliminate the specific cause of those pain triggers. And third, we then build a pain-free foundation for movement. You will need to balance your body. Balance between endurance and strength and stability and mobility. More of any one of those may not be better. It's about the balance. So let's get on with putting this into practice. The next modules will guide you to identify your pain triggers and then guide you to perform movements and exercises very precisely that will help you to desensitize your pain. Pain corrupts your normal movement patterns. You will need to repattern these back to healthy patterns, and we're going to be assisting you with specific cues. Notice the cues that I'm using with the patients to create movement. Movements are automatic. Take walking, for example. You don't need to think about walking. However, pain corrupts these automatic patterns. Some muscles become facilitated and tight, and others become inhibited. But the idea now is to replace these corrupted patterns and cueing the movement so it becomes your new default pattern. You are going to see me using different styles of cueing for the patient. For example, verbal cues are simply verbally expressing what you would like the patient to perform. We also use internal and external cues. You will see me placing the patient's hands over certain muscles so they themselves can feel those muscles activate. And external cues are when I am going to actually put my hands on the patient to get them to activate certain muscles. For example, brushing a muscle is a technique to activate muscle. Always brush against the grain of the hair, and that gives a better cue to activate that specific muscle. But all of these cues will help you create those pain-free default movement patterns. A final note to trainers and coaches on professionalism. We studied a group of firefighters in Pensacola, Florida. In the first group, they just did exercise for a number of weeks, and we measured how well they moved. The second group were coached by very good coaches using the various coaching cues that I'm describing now. At the end of the study, we measured how well the firefighters worked at their actual firefighting jobs. And those who were well coached with good cueing transferred that good movement to all of their occupational duties on the fire ground. Good coaching pays off. Good cueing pays off. So keep referring back to the Back Mechanic book and these videos to remind yourself of the various pain-sparing movement patterns.